Have you ever felt like the world is spinning, even when you're standing still? Or perhaps a sense of unsteadiness, as if you're walking on a boat? These sensations can be debilitating, and sometimes they stem from a condition called psychogenic dizziness, also known as functional dizziness. This isn't about physical damage to your inner ear. It's about how your brain processes signals related to balance and motion. In this video, we'll delve into the complexities of psychogenic dizziness, exploring its causes, symptoms, diagnosis, and treatment, offering you a comprehensive understanding of this often misunderstood condition. Pinpointing the exact cause of psychogenic dizziness can be challenging, as it's rarely a single factor. Stress, anxiety, and depression are frequently implicated. Traumatic events, chronic pain, or even a previous episode of true vertigo can also trigger it. Think of it as your brain becoming overly sensitive and reactive to signals, even normal ones, resulting in dizziness or imbalance. Essentially, the body's normal response to stress or past experiences becomes maladaptive, leading to persistent dizziness symptoms. Unlike many balance disorders caused by physical problems in the inner ear or brain, psychogenic dizziness involves altered brain function. The brain's interpretation of sensory input from the inner ear, eyes, and muscles is disrupted. This can lead to a mismatch between what the body is physically experiencing and what the brain perceives, causing a sensation of dizziness, unsteadiness, or disorientation. The areas of the brain involved in anxiety and emotional processing seem to play a significant role, further emphasizing the link between mental health and this condition. While exact numbers are difficult to ascertain, psychogenic dizziness is thought to be quite common, particularly among individuals with anxiety disorders, depression, or a history of trauma. It can affect people of all ages, but appears to be more prevalent in adults, especially women. Because it's often underdiagnosed or misdiagnosed, the true prevalence is likely higher than reported. It's important to remember that you are not alone in experiencing these symptoms. The symptoms of psychogenic dizziness can vary from person to person, but some common complaints include a feeling of unsteadiness or imbalance, a rocking or swaying sensation, lightheadedness, and a feeling of being disoriented. Many individuals also describe a heightened awareness of their body's movements and sensations. These symptoms can be persistent, lasting for months or even years. They are often exacerbated by stress, anxiety, and crowded or visually stimulating environments. Additionally, individuals may experience associated symptoms such as fatigue, headaches, and difficulty concentrating. Diagnosing psychogenic dizziness involves a thorough evaluation by a healthcare professional. This typically includes a comprehensive medical history, a physical examination, and various balance tests to rule out other potential causes of dizziness, such as inner ear disorders or neurological conditions. Psychological assessments may also be conducted to evaluate anxiety, depression, or other mental health concerns. The diagnosis is often made when other causes of dizziness have been excluded, and the patient's symptoms are strongly linked to psychological factors. Psychogenic dizziness can be broken down into different classifications. Persistent postural perceptual dizziness, a 3PD, is the most accepted diagnosis criteria. 3PD is considered a chronic dizziness that is triggered and persists after the trigger is no longer present. It is defined as persistent dizziness and unsteadiness lasting for 3 months or more, associated with increased attention to body sway or visual stimuli, often triggered by events like vestibular disorders, panic attacks, or physical injuries. The treatment of psychogenic dizziness typically involves a multidisciplinary approach. Cognitive behavioral therapy, CBT, is often recommended to help individuals manage anxiety and change negative thought patterns that contribute to their dizziness. Vestibular rehabilitation therapy can also be helpful in improving balance and reducing sensitivity to motion. In some cases, medication, such as antidepressants or anti-anxiety drugs, may be prescribed to address underlying mental health conditions. Lifestyle modifications, such as regular exercise, stress management techniques, and adequate sleep, can also play a significant role in managing symptoms. The key is a holistic approach that addresses both the physical and psychological aspects of the condition. While it may not always be possible to prevent psychogenic dizziness, there are steps you can take to reduce your risk. Managing stress through relaxation techniques such as meditation or yoga can be beneficial. Addressing underlying anxiety or depression through therapy or medication can also help. Additionally, practicing good sleep hygiene, maintaining a healthy diet, and engaging in regular exercise can contribute to overall well-being and reduce the likelihood of developing this condition. The prognosis for psychogenic dizziness varies depending on the individual and the severity of their symptoms. With appropriate treatment, many people experience significant improvement in their symptoms and quality of life. However, it's important to remember that recovery can be a gradual process, and setbacks may occur. Recent research is focused on further understanding the brain mechanisms involved in psychogenic dizziness and developing more targeted treatments. Studies are exploring the effectiveness of various therapies, including virtual reality-based vestibular rehabilitation and mindfulness-based interventions. These advancements offer hope for improved outcomes and a better understanding of this complex condition.